We have worked very hard, our team, with the support of our headquarters and in partnership with many partners, including the African Union, the Africa CDC, other UN agencies, to support countries, first of all, quite early on in preparedness. So we've carried out significant numbers of trainings for different healthcare workers who have to play different roles in areas such as surveillance, in case management, in laboratory diagnostics. So some capacity has been built through training that WHO has carried out. We've helped our member states to develop national plans for the response. I believe almost all the 47 member states now have a plan that's been developed, because this is central to their being able to mobilize the resources that they need internationally in order to carry out these activities that constitute a good state of readiness, and in case they have cases, that then enable them to respond. So we have, I think, fielded about 80 experts from WHO, either our staff members or consultants that we've recruited to 30 countries. We've also mobilized experts among countries so that there's been an exchange of expertise, so to help carry out such functions as establish an incident management system. That's one of the most critical functions that has to happen, because it's where all the data is put together and where the, if you like, command center for actions to be taken is coordinated. We've helped many countries set up their rapid response teams so that they know exactly who has to go where to do what, in order, again, to make sure that the readiness is functioning properly. So we have also worked very much with partners, with the UN, in our efforts to support countries to get prepared themselves. And we recognize that the response to this pandemic does not only lie in the actions of the health sector. We need all government responses, and among the UN agencies, we need a multi-sectoral response or a support that engages agencies that work on different aspects of this. So, for example, we are expecting our colleagues from UNICEF to very much be engaged in risk communication, in community engagement, so that people get the information that they need, and we follow up what is it that people are believing, hearing, so that we make sure that they take the correct measures in order to protect themselves. Another example is that we are promoting very strongly hand hygiene, hand washing, and we know that in many of the contexts in our countries, water is simply not easily available. You don't just reach out and turn on a tap. In many households, they don't have running water, or there may be communal taps. So we are going to be working with our colleagues at UNICEF and other agencies to make sure that the water is availed. Some of our UN agency colleagues and agencies, particularly now in the context of reduced movement, have the capacity to support with logistics. They have aeroplanes, they have ways of moving people and equipment and supplies around. So these are the partnerships that we are setting up within the UN with some bilateral agencies, and very much to support the action in countries. We procured at the beginning of the preparedness activities some supplies which are considered to be critical to this work. So, for example, laboratory kits, laboratory equipment, as well as supplies for personal protection, including masks, gloves, and kits that are meant to help protect healthcare workers and ensure that people don't get infected in the course of doing their work in relation to this outbreak. We're working a great deal with the Africa CDC and also with the African Union Commission, of which the Africa CDC is a technical body. We've carried out many trainings together on the different aspects of preparedness and response, on laboratory capacity building, testing, on case management, on surveillance. So we have worked really hand in hand with the Africa CDC. At the political level, they have organized, and we have participated very actively in ministerial meetings where in Addis Ababa, ministers from all African countries attended, and were able to brief them on the most important interventions that they have to put in place, and also help them understand how to work with WHO, with the Africa CDC, and also with other partners. We, in our turn, organized sub-regional meetings of partners in Nairobi and Dakar for the Western, Central, and Eastern Southern African regions. And the Africa CDC was a very active participant in those meetings where we agreed how they would work with us, with UN agencies, with bilateral partners, and other technical agencies, so that we synergize our efforts together across a range of partners. We really are working very closely with them. And of course, the director of the Africa CDC is now nominated as a WHO Goodwill Ambassador for this work. So we're going to be working very closely together with Dr. John Kengaso. A great deal of work is going on to identify a candidate vaccine that might be viable to use for this. I believe there are about 20 being tested at the moment by different researchers. What is very encouraging is that some of the experience that we've had with vaccine development around the Ebola virus, for example, are being used now to promote partnership, sharing of information around the development of a vaccine. Well, clearly, developing a vaccine, even in this fast tracking mode of working, takes some time. So we don't expect that there's going to be a vaccine available, at least during this year. But we're very encouraged by the determination and the efforts that are going on to find a vaccine. And of course, we would need to make sure, now that we are aware of this early on, that we work with the partners that traditionally ensure access to vaccines to prepare African countries to receive and use this vaccine. We work very closely with the regulatory authorities in these countries, and what we can offer is linking up with them early on to make sure that there are no obstacles and delays in making it available in the countries.